Older adults in the hospital sometimes experience changes in memory or thinking. Understanding these changes helps us learn why it happens to some people and not others, and find better ways to support them in the future. The purpose of this training video is to teach you how to use the UBCam screening tool to assess for delirium. There are 4 features used to screen for delirium. 1. Acute change and/or fluctuating mental status. 2. Inattention. 3. Disorganized thinking. And 4. Altered level of consciousness. For someone to have a positive screen for delirium, you need at least 1 sign of acute change and/or fluctuating course, and at least 1 sign of inattention and either 1 sign of disorganized thinking or an altered level of consciousness. So, they must have features 1 and 2 and either 3 or 4. The UBCam is a smart tool developed to assist in the identification of these features. When using the UBCam, start by introducing yourself to your patient as part of your healthcare team. I have a few questions to check your memory and thinking, which will help us to better care for you. This is an important daily check-in that we consider part of taking your vital signs, like blood pressure and temperature. First, assess the patient for severe lethargy or severe altered level of consciousness. Severe lethargy or severe altered level of consciousness is present if there is no response to voice or touch, or minimal response to voice or touch. Do not mark this feature as present if the patient is asleep and you can easily awaken them. If present, the patient is considered delirious and no further items are administered. If severe lethargy is not present, the UBCam will take you to the next 2 questions. Ask the patient, "Please tell me the day of the week." Answer must be exact to be correct. It is okay if they look at the whiteboard, a newspaper, or their phone. However, they cannot ask another person or be given cues. Ask the patient, "Please tell me the months of the year backwards. Say December as your first month." All 12 months must be present and stated in the correct order to be considered correct. If the patient answered both questions correctly, assessment is automatically stopped and patient is considered not delirious. These 2 questions take less than 40 seconds to ask, and roughly 60% of your patients will get these first 2 questions correct. If the patient answered at least 1 question incorrectly, the UBCam will determine which additional questions should be asked to assess for delirium. This may change from patient to patient, as the UBCam is smart and will ask the least number of questions necessary. On average, it takes about 1 minute and 30 seconds to complete the assessment when additional questions are needed. Next, we will review all the possible questions that you may need to ask when using the UBCam. Ask the patient, "Please tell me the year we are in right now." The patient's answer must be the exact year. Ask the patient, "Please tell me what type of place this is." Patient should say hospital, but other answers may be acceptable, such as medical facility, etc. Ask the patient, "Please tell me the days of the week backwards." Say Saturday as your first day. The patient must state all 7 days in the correct order to be considered correct. For the next 2 items, say each set of numbers only once, and make sure to read 1 number per second. If patient's answer is not exact, it's considered incorrect. Ask the patient, "Repeat these numbers in backwards order. 7, 5, 1. Ask the patient, "Repeat these numbers in backwards order. 8, 2, 4, 3. Ask the patient, "Over the past day, have you felt confused?" This question can be rephrased if needed to ensure the patient understands. You can rephrase to say, "Have you felt mixed up about things you normally don't feel mixed up about?" For example, mixing up day and night. Note: do not code for confusion if they are confused about valid things like why they're still in the hospital or their diagnosis. You may need to probe for details. Ask the patient, "Over the past day, did you think you were not really in the hospital?" You should not count responses that indicate a disorientation that seems to be within the range of normal, such as a patient saying, "I woke up in the middle of the night and it was dark, and it took me about 10 seconds to remember that I was in the hospital." Ask the patient, "Over the past day, did you see things that were not really there?" You can rephrase to say, "Did anything unusual happen where you thought your eyes were playing tricks on you?" At this point, the patient-facing questions are complete. Please answer any remaining observational questions that appear in the UBCam. Which questions appear depends on how patient answered the patient-facing questions. The UBCam will take you to the additional questions deemed necessary. Next, we will review all possible observational questions. Ask yourself, was the patient sleepy during the interview? This requires observing actual signs of sleep, not just a profound tiredness with eyes closed. You need to witness signs of sleep that include eyes rolling back, twitching, snoring, head bobbing, etc. Ask yourself, did the patient show hypervigilance? This would include unusual startle responses to ordinary stimuli. Ask yourself, was the patient's flow of ideas unclear or illogical? This would be positive if the patient had any answers or speech that didn't make sense. Patient's behavior can also indicate unclear or illogical thinking, including actions that don't make sense or answers that contradict earlier statements. Ask yourself, was the patient's conversation rambling, inappropriately verbose, or tangential? This can be difficult to assess given some people give long answers. If the patient talks a lot but eventually answers the questions, it's not considered disorganized. Ask yourself, was the patient's speech unusually limited or sparse? This usually is in the form of one-word repetitive answers or grunts. Ask yourself, did the patient have trouble keeping track of what was said or following directions? This would be positive if you had to repeat a question for a reason other than the patient's poor hearing or external noise. Ask yourself, did the patient seem inappropriately distracted by external stimuli? Generally, if you are not distracted by something, the patient should also be able to stay focused on the assessment. Ask yourself, did the patient's level of consciousness, level of attention, or speech thinking fluctuate during the interview? One way to assess fluctuation is to cut the assessment in half and compare the two halves. If either level of consciousness, level of attention, or speech thinking was distinctly different between those two halves, fluctuation could be present. Another way to observe fluctuation is when the patient gets an easier attention item wrong and the harder attention item correct, and you feel surprised by their performance. Ask yourself, if no prior assessments, is there evidence of an acute change in memory or thinking according to records or informant? Ask someone familiar with the patient's baseline if they've noticed any changes in memory or thinking, or a new or worsening confusion in the last few days or weeks. Ask yourself, if prior assessments, are there any new signs of delirium based on above questions? Any new error indicates acute change. As a reminder, you won't be asking the patient every question or answering all of the observational questions because the UBCam is smart and uses a skip pattern to assess delirium features and will ask the least number of questions possible. Based on the combination of answers from the patient-facing questions and your observational questions, the UBCam will produce the result for you, saying if delirium is present or absent in the patient.